Time for part two of Wellness Wednesday this morning. And sepsis affects close to 50 million people around the world every year. But a team of Canadian researchers have created the first ever test that can predict a patient's likelihood of developing sepsis. Now, the findings were published yesterday in the journal Nature Communications. And the senior author of the research paper is a clinician scientist and critical care physician, so practicing at St. Michael's Hospital. She joins us now live this morning on CB24 Breakfast. Dr. Claudia Dos Santos, appreciate the time this morning. Congratulations on this breakthrough in sepsis research and testing. Let's talk about this. First of all, for some people who don't understand what sepsis quite is, give us a quick sort of summary.
Sure. So sepsis is a devastating disorder. It's actually the immune response to an infection. So the immune response goes haywire, and it's a little bit like an avalanche. It doesn't matter sometimes whether you can actually get rid of the bug that initiated the process. The immune response of the host, of the person affected, just takes over and just drives organ dysfunction and sepsis.
And when it comes to diagnosing it, is that difficult for doctors? Is it hard to say, certainly this person has sepsis prior to what we're going to talk about?
Well, yes, it is, because patients present very differently, present non-specifically, and very often time is of the essence. Mortality increases by 8% with each hour of delay. So doctors, usually, they just treat on suspicion. If you're suspicious, you go ahead and you treat. You don't wait. And a lot of the tests require time and need to, they don't come back immediately. So it is something that doctors just have to do on the basis of suspicion.
Right. But now you and your team have come up with this test that's quite remarkable. It's years and years of research and study. Tell us about the breakthrough you've come up with then.
So I'm part of an enormous team in Canada, so a trans-Canadian team, very proud of them. National Research Council of Canada, the engineers that actually developed the device, and the fantastic machine learning and AI experts at the University of British Columbia and Sepsis, the group that sort of put together the biomarkers that we're using to detect sepsis. So this test identifies 6 genes that are differentially present in patients who are very likely to develop sepsis tomorrow. So that when we see patients today, we can say, tomorrow is going to be a key day. They're really going to deteriorate. And so we can act very quickly.
And if they already have sepsis, does that change the test at all? Or
no, the test still works and provides us with even more information about how sick they're going to get.
You talked about time being of the essence. I assume if you can tell tomorrow what someone is going to have today, the treatment plan changes entirely.
It's entirely possible. Like, that's going to be part of the work that we are going to be testing prospectively in a clinical trial upcoming in the later part of the year.
And what kind of accuracy are we talking about in terms of this test to say, hey, in fact, yeah, we're very certain that you are going to have sepsis?
Yeah, so the accuracy is between 88 to 92%. So the predictive ability of the test is really high.
That's enormous. You mentioned something, Dr. Dos Santos, about AI and machine learning in this.
Yeah.
We talk a lot about the negatives around AI, in the news these days because of dark web and deep fakes and things like this. This sounds like one of the positive elements to AI. Could you drill down a little more on that for us?
So I'm very fortunate because I've seen the most positive part of machine learning, and AI is a significant number of tools that we use, the computational community uses. And it can really allow us to integrate information that would otherwise take years for us to integrate. Genetic, molecular information with clinical information, with biochemical tests, with radiological data. So it really allows us to contextualize molecular changes, which is exactly what helped us to develop the test for patients with sepsis.
When could you see this, doctor, being more widespread, more used, in hospitals, perhaps globally beyond Canada?
Well, I hope so. That's the hope. So I think the first step is a Canadian Health Research Institute sponsored clinical trial. And we're sort of enrolling about 200 patients. That's our plan. And once the results of the trials are in and we see in the real world the performance of the prototype device, then we can go to hopefully Health Canada and ask for Health Canada approval to actually make the devices and start deploying them at the bedside, which is hopefully it's going to be great. Right?
I certainly hope so, for your sake and for the sake of course, so many people in the country. I mean, would you say 11 million people die annually globally?
That's right.
Due to sepsis?
11 million people die annually. And in Canada, it's about 1 in 18.
And it sounds to me like it's almost preventable if you find out soon enough.
It has been estimated that about 80% of sepsis deaths may be preventable with early intervention and appropriate intervention.
What a breakthrough this is. Dr. Dos Santos, really appreciate this. Congratulations
Thank
to
you
you and your team. Thank
Thanks
you for
so much
joining
for
us this
having
morning.
me.
Thank you so much for
Thank
your
you.
research. Okay.